Are you struggling with psoriasis and unsure which treatment option is right for you? Well, look no further, because in this video, we will be comparing two popular medications, Enbrel and Stelara. Psoriasis is a chronic autoimmune skin condition that affects millions of people worldwide, causing red, scaly patches on the skin. Enbrel and Stelara are both biologic drugs approved by the FDA for the treatment of moderate to severe psoriasis. Enbrel, an anti-TNF, tumor necrosis factor, medication, works by suppressing the body's immune response that triggers psoriasis symptoms. On the other hand, Stelara targets specific proteins in the immune system, reducing inflammation and alleviating psoriasis symptoms. In this comprehensive comparison, we will delve into the efficacy, safety profiles, side effects, dosages, and costs of Enbrel and Stelara. By the end of this video, you will have a clear understanding of the key differences between these two medications, empowering you to make an informed decision about your psoriasis treatment. So, let's dive in and find out which medication is the best fit for you. Understanding Enbrel and Stelara. Psoriasis is a complex condition that requires targeted treatment to manage its symptoms effectively. Enbrel and Stelara are both biologics, which means they are derived from living organisms and target specific immune system molecules involved in the development of psoriasis. However, their mechanisms of action differ. Enbrel, also known as etanercept, is an anti-TNF medication. It works by binding to tumor necrosis factor alpha, TNF-alpha, a protein in the body that plays a crucial role in inflammation and the immune response. By binding to TNF-alpha, Enbrel inhibits its action, reducing inflammation and suppressing the symptoms of psoriasis. Stelara, or ustekinumab, is a newer biologic drug that targets interleukin-12, Illinois 12, and interleukin-23, Illinois 23, which are proteins involved in the immune system's response and inflammation. By blocking the action of IL-12 and Illinois 23, Stelara helps regulate the immune response, reducing the severity and frequency of psoriasis flare-ups. Both Enbrel and Stelara are administered by injection, but the frequency and dosage can vary depending on the severity of the condition and the individual's response to treatment. Now, let's explore the efficacy of Enbrel and Stelara in treating psoriasis. Efficacy of Enbrel in treating psoriasis. Enbrel has been widely studied and proven to be effective in treating moderate to severe psoriasis. Clinical trials have shown that Enbrel significantly improves psoriasis symptoms, leading to clearer skin and a reduction in plaque thickness. In one study, approximately 60% of patients achieved at least a 75% improvement in their psoriasis symptoms after 12 weeks of treatment with Enbrel. These results demonstrate the potential of Enbrel to provide substantial relief for individuals suffering from psoriasis. Enbrel's efficacy extends beyond skin clearance. It has also been shown to improve quality of life by reducing itching, pain, and scaling associated with psoriasis. Moreover, Enbrel has demonstrated long-term efficacy, with some patients experiencing sustained improvement for several years. It is important to note that the efficacy of Enbrel may vary from person to person. Factors such as the severity of psoriasis, the duration of the condition, and individual response to treatment can influence the outcomes. Therefore, it is crucial to consult with a healthcare professional to determine if Enbrel is the right choice for your specific case of psoriasis. Efficacy of Stelara in treating psoriasis. Stelara has emerged as a promising treatment option for moderate to severe psoriasis. Clinical trials have shown that Stelara significantly improves psoriasis symptoms, leading to clearer skin and a reduction in plaque thickness. In one study, approximately 70% of patients achieved at least a 75% improvement in their psoriasis symptoms after 12 weeks of treatment with Stelara. These results highlight the effectiveness of Stelara in providing relief for individuals with psoriasis. In addition to its impact on skin clearance, Stelara has also demonstrated long-term efficacy. Some patients have experienced sustained improvement for up to 5 years, suggesting that Stelara may be an effective long-term treatment option for psoriasis. As with any medication, the efficacy of Stelara can vary from person to person. Factors such as the severity of psoriasis, the duration of the condition, and individual response to treatment can influence the outcomes. Therefore, it is crucial to consult with a healthcare professional to determine if Stelara is the right choice for your specific case of psoriasis. Safety profile of Enbrel. When considering any medication, it is essential to understand the potential risks and side effects. Enbrel, like any biologic drug, has its own safety profile. Overall, Enbrel is considered to be well tolerated by most patients. Common side effects include injection site reactions, such as redness, pain, and swelling. These reactions are typically mild and resolve on their own. In rare cases, Enbrel may increase the risk of infections, including serious bacterial, viral, and fungal infections. It is important to inform your healthcare provider of any existing infections or a history of infections before starting Enbrel. Additionally, Enbrel may slightly increase the risk of certain types of cancer, such as lymphoma, although the overall risk remains low. Regular monitoring and communication with your healthcare provider are crucial when taking Enbrel to ensure early detection and management of any potential adverse effects. It is important to weigh the potential risks against the benefits of treatment and make an informed decision in consultation with your healthcare provider. Safety profile of Stelara. Stelara has also been shown to have a favorable safety profile in the treatment of psoriasis. The most commonly reported side effects include upper respiratory tract infections, headache, and fatigue. These side effects are generally mild and do not require discontinuation of treatment. Similar to Enbrel, Stelara may increase the risk of infections, including serious bacterial, viral, and fungal infections. It is important to discuss any existing infections or a history of infections with your healthcare provider before starting Stelara. Furthermore, there have been rare cases of serious allergic reactions associated with Stelara, although these occurrences are extremely rare. Regular monitoring and open communication with your healthcare provider are essential when taking Stelara. It is important to report any new or worsening symptoms promptly to ensure the timely management of any potential adverse effects. As with any medication, the potential risks should be carefully considered in relation to the benefits of treatment, and a healthcare professional should be consulted before starting Stelara. Comparing the cost of Enbrel and Stelara. Cost is an important factor to consider when choosing a psoriasis treatment. Both Enbrel and Stelara are biologic drugs, which tend to be more expensive than traditional treatments for psoriasis. The cost of these medications can vary depending on factors such as the dosage, frequency of administration, and individual insurance coverage. Enbrel typically requires more frequent injections, usually once or twice a week, initially. Over time, the frequency may decrease to once every 2 weeks. Stelara, on the other hand, is administered less frequently, usually with an initial dose followed by maintenance doses every 12 weeks. The cost of Enbrel and Stelara can vary significantly depending on the country and the healthcare system. It is advisable to check with your healthcare provider and insurance company to understand the specific costs associated with these medications. In some cases, financial assistance programs or patient assistance programs may be available to help offset the cost of treatment. Patient experiences and reviews of Enbrel and Stelara. Hearing from individuals who have first-hand experience with Enbrel and Stelara can provide valuable insights into the effectiveness and tolerability of these medications. Many patients have reported positive experiences with both Enbrel and Stelara, citing improvements in their psoriasis symptoms and overall quality of life. Some patients have reported rapid and significant improvements in their psoriasis symptoms after starting Enbrel, while others have experienced a gradual but steady improvement over time. Similarly, patients who have used Stelara have reported positive outcomes, with many achieving long-lasting remission and improved skin clearance. It is important to remember that individual experiences may vary, and what works for one person may not necessarily work for another. Consulting with a healthcare provider and considering individual factors is crucial in determining the most suitable treatment option for psoriasis. Choosing between Enbrel and Stelara for psoriasis treatment. When deciding between Enbrel and Stelara for psoriasis treatment, several factors should be considered. These include the severity of your psoriasis, your medical history, your response to previous treatments, potential side effects, dosing frequency, and cost. Enbrel and Stelara have proven efficacy in treating moderate to severe psoriasis, with high response rates reported in clinical trials. However, individual responses can vary, and the choice between the two medications should be based on a careful evaluation of your specific needs and circumstances. Your healthcare provider can guide you through the decision-making process, considering your unique situation and treatment goals. They will take into account factors such as the severity and location of your psoriasis, any comorbidities, potential drug interactions, and your preferences. It is important to have an open and honest conversation with your healthcare provider, discussing your expectations, concerns, and any limitations you may have. Together, you can make an informed decision about which medication is the best fit for you. Conclusion and final thoughts. Enbrel and Stelara are both effective treatment options for moderate to severe psoriasis. They belong to the class of biologic drugs and target specific immune system molecules involved in the development of psoriasis. While Enbrel inhibits tumor necrosis factor alpha, Stelara blocks interleukin-12 and interleukin-23. Both medications have shown significant efficacy in improving psoriasis symptoms, leading to clearer skin and a reduction in plaque thickness. However, individual responses may vary, and factors such as the severity of psoriasis, medical history, and cost should be considered when choosing between Enbrel and Stelara. It is crucial to consult with a healthcare professional who can assess your specific needs and guide you through the decision-making process. Your healthcare provider will consider factors such as the severity of your psoriasis, your medical history, potential side effects, dosing frequency, and cost to determine the most suitable treatment option for you. By understanding the efficacy, safety profiles, side effects, dosages, and costs of Enbrel and Stelara, you can make an informed decision about your psoriasis treatment. Remember, everyone's experience with psoriasis is unique, and what works for one person may not work for another. Working closely with your healthcare provider and being proactive in managing your psoriasis will help you achieve the best possible outcomes.